We will be posting it on the Dental Informatics YouTube, the YouTube channel, and so it will be made available later. Please continue to check out the listserv. I will make it available there. And please share with colleagues who may not be able to attend today. We will ask questions using the chat feature. So as we are presenting today, we'll ask that everybody please ask questions as we go using the chat feature. However, we will answer them at the end of all 3 presentations. I'd like to introduce our presenters today. Starting with our first presentation, The Wild West, a qualitative data analytics approach to design. That will be presented by Ms. Kara Kennedy, Senior Data Analyst, and Ms. Cassandra Callahan, Director of Dental Informatics, both at University of Michigan. Our second presentation is entitled The Electronic Dashboard to Monitor Student Clinic Experiences, and that will be presented by Dr. Hollis Lay, Assistant Dean of Education, Quality and Accreditation, and Dr. Doris Lunarden, Associate Chair of Clinical Operations, Faculty of Medicine and Dentistry, both at University of Alberta. Our last presentation is entitled, In Their Own Words, Students' Perspective on Privacy and Library Participation in Learning Analytics, presented by Ms. Abigail Goben, Associate Professor and Data Management Librarian at University of Illinois at Chicago.
Hi everyone, this is Cassandra Callahan. I just want to preview to let you know that we have major building renovation going on in our building, so apologize if you hear background drilling noise. We thought we found a room that you wouldn't be able to, but that doesn't seem to be the case. So I have with me our senior data analyst, and she has put together a wonderful presentation today on approaching to design when you think about qualitative data analytics.
Thanks, Cassandra. So welcome everyone. Okay. Oh, no, there we go. So when we think of qualitative data and quantitative data, we often think that quantitative data is data that involves numbers, and qualitative data is data that involves purely words. But actually that's not the case. We have a fair amount of numerical data within qualitative data. That is, and I'm so sorry, let me move my control panel around, such as self-assessment elements, binary patient data like medication status of 0 or 1. It's not letting me. Patient zip. Patient address is also an example of quantitative data. Survey results, of course, clinical assessment elements, course number, patient age groups, procedure code, so D4341 or D4342, subscriber numbers, MRN or chart numbers. So there's all of this uncharted qualitative territory. So we have a vast amount of qualitative data at our hands, and the issue is that there are many different approaches to analyze qualitative data. In fact, Santiago and Della Fosse in 2016 identified 81 discrete sets of guidelines. So it's also a well-documented phenomenon that researchers are interested in primarily objective data, so data that is quantitative. And I've linked here, which we'll share out after the presentation, but I've linked here to a 2017 article that points just to this. There are a fair amount of gold mines, though, in analyzing qualitative data using a really rigorous approach. First, as you all know, it's a tenet of learning analytics and is evidence-based. And I've also linked to an article to support that here. It can be useful in many different areas. so in research and development and academia, which really conveniently dovetails with the University of Michigan School of Dentistry's mission. So why though? Why are we using a qualitative data analytics approach with design? First, as I mentioned, it's mission driven. So our mission at the School of Dentistry here at University of Michigan is advancing health through education, service, research, and discovery. So as someone who works with data and works with design, and of course does requirements gathering, this is also an approach that can be really beneficial for user-centered design and usability. And I ripped this from Wikipedia, but the definition of user-centered design and usability in Wikipedia discussed that the difference from other product design philosophies is that user-centered design tries to optimize the product around how users can, want, or need to use the product, rather than forcing the users to change their behavior to accommodate the product. And of course, we have a variety of users here at the School of Dentistry. In fact, we have 1,082 diverse stakeholders, so students, staff, and faculty. So we were tasked at the School of Dentistry with creating a student dashboard learning initiative. So the project charge for this initiative was to enable students to track their own progress and identify areas that they would like to improve. So of course we did some requirements gathering. We did a persona analysis. And when we did that, we also did a scope identification. And so we tried to figure out who our target audience was. Was our target audience staff? Was it faculty? Was it students themselves? So we decided to hold a focus group for students to gather some feedback about what they wanted in a dashboard. So what we found out was that we didn't just need one dashboard, but we actually needed two different dashboards. We needed a dashboard for administrators, so staff and faculty, but we also needed a dashboard for students themselves. So how were our focus groups set up? How did we design them? They were self-identified students from each class, so D1s through D3s. We had the population of students had different approaches to learning. There were some pre-doc students, some ITDP students, students looking to continue into a specialty. And the way that we structured the focus group, we asked questions that specifically targeted the project charge. So our purpose was to enable students to track their own progress and identify areas that they would like to improve. So we asked questions like, how do you currently track your progress, and how do you know which areas you need to improve in? So what did we do with this focus group data? Of course, we have a ton of it, and we needed a really rigorous approach that would allow us to objectively look at the data that we collected and lead us to some conclusions about this data. So we used a method called the KJ method, which involved affinity wall diagramming. So you can see over here on the right-hand side of your screen an example of affinity wall diagramming. So through that process, we engaged a fair amount of non-IT staff. So our subcommittee was comprised of dental informatics members like myself, but also some support staff. So the registrar was also on our subcommittee. The KJ method uses inductive reasoning to sort of look at the data, draw some themes from the data, and then really explore those themes. So what were our results? So preliminary results, because of course we're still working on this. There were some technical outcomes, of course. First, students wanted a single unifying tool. They also wanted to be able to access this tool from multiple devices. And finally, they wanted metrics that showed course progress as well as program progress. There were also a surprising amount of non-technical outcomes, despite the charge at the outset. First, they wanted a comprehensive syllabus and grading rubric. They wanted some sort of symmetry between what was handed out on a piece of paper and what was on the LMS itself. Second, they were interested in timeliness. So they were interested in having a grade after they took an exam or a quiz or completed an assignment, they wanted the score for that to be entered soon after. And it seemed like occasionally in some courses, but not others, some grades were submitted in batches. Further, they wanted some more verbal and written feedback. And last but not least, they struggled with test cases. So test cases can be completed in one semester, in many semesters, and so they had some issues tracking how many test cases they did, when they completed them, and they wanted some sort of official documentation or recommendation from the school about how to better track that. So this is actually an example taken from our student dashboard. This is still in development, so this is a sneak peek, but this really targets what students wanted. So this is regarding test cases, as I just mentioned, and it was created in Tableau, as you can see. It is also available on different devices too. So students had asked to see things on a tablet, on a phone, on their desktop, and Tableau very easily lets students do that. So new frontiers in qualitative data analysis, where are we going next here at the School of Dentistry? We are digging deeper into machine learning to provide some more predictive power and deeper insights into our qualitative data. We're also using NLP to explore free and open text fields. So for instance, in our EDR Axiom, we're looking at the other open text field in medications. We're looking at treatment notes and health history forms. And we're also looking at student self-assessments. So qualitative analysis can be an engaging, informative exercise when designing new tools. So for any questions or collaborations, feel free to contact Cassandra or myself. We will send this presentation out, as Annalise mentioned, at the end of all of the presentations. Thank you. Yes. And I will hand it over to Hollis in just a second.
All right, so can everybody see my screen? Yeah, it's there. So my name is Hollis. With me is Doris Lenard, and we basically pursued this project for developing an electronic dashboard to monitor the student clinical experiences to improve the student learning outcomes when they're learning in the clinic. We're from the University of Alberta, and this is our building. So when it came down to student clinical experiences, they kind of vary by the various patient presentations that kind of comes in and out of the clinic. When a graduating student really needs to demonstrate a consistent level of competence across a range of procedures and presentation, this is kind of troublesome because the student may not necessarily have the adequate exposure to the encounter. And also a second point of issue is that the assignment of patients to the students may not necessarily have assigned it appropriately towards the student's needs. And finally, the clinical instructors may not necessarily know the student's progress as this on the various types and the various quantity of the presentations as the year goes on. So this information is currently being collected on a clinic management system, Axiom, that can be queried, but with effort. So we have the ability to do it on an individual basis of finding out what individual students have the experiences on, but then you would need to query various cases, and then you would need to download various types. So the purpose of this presentation really is just to demonstrate how we built an electronic dashboard in order to manage and aggregate all of these concerns. So And tell you a little bit of our dashboard. It was created independently from Axiom, but it uses Axiom data. The inputs that we require is a daily Axiom export through CSVs and import it into the dashboard. There's a set of competency codes that are identified by the instructors as the required clinical encounters. And in order to access this information, there needs to be authentication that's done through what we call CCID, but it's very similar to any SSO type of requirements that are out there. The functionality that's required when we started doing this work a year ago was the provide oversight of the instruction teams. So when we have our clinic and our students are divided by various teams. So there's 4 teams of that students belong to, and they require a certain level of oversight within the team dynamic of how the patients are assigned to the teams. There's a second level of oversight, which is at the individual level. The students individually need to have the adequate level of encounters, as well as providing an oversight on the clinical areas, which means that clinical areas needs to ensure that they provide adequate level of encounters and that their expectation for the students are adequate. So that's the 3 levels of oversights that we have. So here's an example of what our dashboard looks like. On the bottom there, you'll see that we can report. It's a flexible dashboard so that it can be queried and it can be sorted in different ways. On each row on the bottom there, they're presented by teams. If you click on each and every one of them, then it goes into individual students that belongs to the team. For each columns, you can see that there's the number of consults, there's this number of root canals. So I'm just using a endodontics area as an example. Each of the cells are presented in different colors. So the black would mean it's completed. That's the first cell. Second is in blue, is in progress. There's a number of cases that are in planning. There's different levels of planning, and then there's the goal. So that is the requirements as set out by the various instructors. All of this information can be queried and can be sorted by and filtered by their team, by the individual students, by the academic year, by the class, graduating class that they're expected to be in. It can be queried within a date range, and there's also the various types of patient demographics that we can query off of. So when we kind of drill down to each of these individual levels, as you click, the individual cells can be clicked through so that you can actually drill down to the specific encounters. So here is an example of how we can display, okay, for the class of 2020, we want to look at the progress of Team 2. We want to look at how many single root canals that they've done. And here I've blocked out the student identifying information and the chart numbers. But all of this information, as you can see, we can see the recall dates, we can see the dates of completion, and we can see the treatment that's provided, the code that's associated with it, and the perio status of that given patient. So this information is updated on a daily basis, and this information is being used by the what's called a treatment coordinator. So when it comes down to the software piece that we've developed for the dashboard, there's also a human process that we needed to align in order to make sure all of this worked together. The treatment coordinators that are new are tasked with reviewing the dashboard and matching the students and their needs with the incoming patient presentation. So for example, if someone needs to see a root canal, we will, and there's different students that have already seen the root canals, they'll start to prioritize the patient with the root canal need with a student that needs to see a root canal, for example. There's also a alignment, a training towards discipline leads in order to review the dashboard to ensure that there's sufficient clinical experiences are met by all students. So for example, if the discipline lead is setting a standard that is too high, where we don't have enough patient encounters for the students to see them, then they can adjust their expectations accordingly. The team directors will also review the progress of each of the students. So they're responsible for making sure that all students have the adequate progress throughout the year. And training was also provided to instructor and staff so that they can keep track of some of this information on an ongoing basis. So we really just developed one single dashboard in order to manage all of this information. So how did this all work out together? We've deployed this dashboard for 1 full year now, and we were able to do a small study in order to compare with the results of the previous year, because everything is kept onto our electronic records, so we can compare year to year how it went. The years that we're comparing with, we actually made a comparison between 1 term and 2 terms. And the variables that were used is the number of codes, so just by quantity of the number of experiences that the students have provided, the categories of codes that are identified by the instructors as necessary for the completion of their education, and the years of study. And we just use a simple independent t-test in order to compare all of this. So here we have a summary of an increase in the number of categories. So the counts is the quantitative number of codes. So on average, number of there's 53 for the fall term. On average there's 53 codes that are entered by per student. And that for categories, there's on average a number of 27 categories that the students have encountered. For year 4, on average, there's 144 on the year that they used the dashboard, compared to 112 count of codes. That's where that were used in the that were encountered by the students. So overall, we saw an increase in the fall term. And after the fall and winter term, what we're able to notice is that even though the count for year 3 and categories has increased still, that there is not a significant number of increases for the year 4, but their categories has increased. So overall, what this all meant was there's an increase of 26% of the number of patients, codes recorded by the students, and that means likely they have performed 26% more of the clinical codes. And in terms of the breakdown, in purple, you'll see that there's a consistent increase in the first term, but then that tapers off in the second term for the year 4 students. So what does this all mean? Overall, the use of dashboard has encouraged an increase of 26% on all clinical codes that are recorded. The number of categories has also increased on average for 26%. But there's a gain in the year 4 that tapers, and that's likely because a review on the student clinical experiences is conducted before they graduate after the first term. So likely any type of missed type of clinical experiences are made up in that time. And the deployment overall has a general positive impact on the student experiences, where because of the existence of the dashboard, we're able to enable the tracking and allocation of student exposure. We're able to allow for student progress monitoring throughout the year using that same dashboard. And the disciplines have an increased sense of student exposure because they get feedback on whether or not their expectations meet the requirements of the actual patient presentations. So thank you very much for your attention.
All right. And I get to go third. Again, my name is Abigail Gobin, and should be getting my screen now. Let's see if we can get that up. There we go. Okay, so my name is Abigail Gobin, and I'm at the University of Illinois in Chicago. So this is student perspectives on privacy and library participation in learning analytics. And while I'll be talking about libraries specifically, this has a lot of relevance, and I'm the liaison to the College of Dentistry. So we're seeing a lot of relevance with learning analytics questions there as well. This is part of a big research grant and research project. This is my team. My PI is at IUPUI. We are the Data Doubles team, and we're spread out across the country. And we are IMLS funded. So to give you an idea, this is a 3-year project where we're looking at privacy issues around learning analytics. And what I'll be telling you about today is the results from year 1, which is our student interviews. And these are our guiding research questions. We wanted to know what it is that students identified when we asked them about learning analytics, whether their privacy perceptions changed, how that maps to initiatives by various stakeholders, and then what do they see as potential privacy problems. So to make sure we're all consistently on the same page, this is the definition of learning analytics that we use, which is measurement, collection, analysis, and reporting of student data in order to understand learning and the environments in which it occurs. And I think that lines up pretty well with what we've heard from the other 2 panelists today. And part of the reason this is so important is when we did an environmental scan a year ago, what we found out is that 83% of the research institutions that we spoke to and heard from were participating in some degree of learning analytics initiative. So, and the other 17% were like, yes, we're working on that. So pretty much everyone is seems to be underway and working on these things. So why is student privacy an issue? When you talk to undergraduate students, what little we do know so far is undergraduates are generally positive. They see the potential value for learning analytics, but they're also worried about that it could be dehumanizing. And they're very, very concerned that if they're sharing data related to them, that it will return immediately useful information to them, not future students, but to them in particular. And why do we care about this? One is autonomy. We know that as soon as we apply these learning analytics and start gathering information, that it can remove some of the autonomy students may have to explore and engage more broadly. And we know that when others access information about us, that will change our behavior. So if someone can see that we are doing a certain thing, we try to game that system, or we try to get the most points. And I know I've run into that with dental students before. So what we undertook in the first year were to do student interviews and really just ask general questions. What do students think is happening? So we did semi-structured interviews with undergraduates. And while they are undergraduates now, they will be our D1s next year potentially. So I see a lot of very similar trends. We aimed to get 120 interviews. Ultimately, we were able to complete 112. And then once we did some quality control, we finished with 105. These are our interview sites. Again, we're across the Midwest and out in Oregon. And we do have one community college partner to help us get some other viewpoints there as well. Our interview structure was that we had 3 core questions that every student got asked. And then we had 5 different areas where we explored more deeply. So privacy, data protections. With the various follow-up questions, each of these protocols took about 30 minutes. Once we went through that, the team wrote case summaries, we established some rough themes, we did open coding and then closed coding. And from the 169 codes that we applied, we have about 4,100 excerpts to go through. So we have just an absolute lot of data that we're trying to wrangle through right now. So I'm interested in hearing more about those qualitative methods, because I have a lot of qualitative data. So these are truly emerging findings. We're in the middle of analysis right now. The overarching thing that we found, though, is when you ask students what data their institution gathers, they don't know. They have not thought about this. And if you can push, if you politely, they can come up with things that might be being tracked. They think about grades. They think about financial information related to loans and things like that. But they're not aware of all of the ways that universities can track them, and there are quite a lot. Sometimes they were able to identify things like the LMS being able to track their digital footprint. And then it was interesting to see the juxtaposition between students that we saw. One who said, I have no idea at all, and another who assumed that, I believe Blackboard in this case, knew every move that they made. When we asked them about libraries and what kind of data the library might be capturing, what was really fascinating to me was that they believe that the library knows what books you've checked out, and that's frequently all they could come up with. And we obviously have a lot more access to data about them than that. It was really surprising to run into this. Many of them didn't understand that as they looked at articles or went through databases, that we could, and the vendors we work with can track all of their work in there. That said, students expressed really nuanced arguments about what data should be restricted. And when they had very liberal opinions, they were very quick to say, this is my opinion, this is how I approach things, but I have classmates who would think differently, and my opinion shouldn't override theirs. They saw the need for more control than perhaps they were initially asking for. One of the things they were very concerned about was the sharing of GPA. Although some did identify mental health, healthcare records, they recognized that there should be special limits on that kind of access. And you can see this articulated here. One student who commented that students at home might not have Wi-Fi available at home, and they may not be able to do things off campus. So we needed to afford them some privacy. They were particularly concerned about third-party access, and that's something we don't always express to them. They wanted it to be aggregate and without personally identifying information. They saw that as restricting the downstream harm when data might be reused by a vendor. And they frequently expressed a desire to be able to review what was being shared and actively consent or not consent to data practices. And again, here another quote from one of our students: if it's not benefiting the student in any way, or it may harm them, then that's where I think you have to draw the line. And harm was articulated a variety of different ways by different students. In terms of the library, they spoke very positively generally about the library, but there was also a lot of concern because we were saying, what do you think about this? And their response was, wait, well, you're gathering this data? It hadn't occurred to them. They're thinking of book checkout. And so their question came back to, what are they researching for this? What are they doing? And we had to try and help with those answers where we could. They often spoke about a desire for protocols or data classifications in place and the need for IRB review or something like that. And that was interesting because if you're following the common rule, QI projects that are internal don't necessarily have to go through IRB anymore. And a lot of learning analytics falls under that. So even when they assumed there might be review, there isn't necessarily. And then this student pointed to the need for difference between us and an institution like Facebook, where they know Facebook is tracking every move, and they think the library and the university should be different and that we should not betray their trust. A lot of this came back to a question of informed consent and whether or not students can actually provide informed consent for learning analytics. Often as we worked through these questions, they had an idea at the beginning and then they would work through to more nuanced perspectives and they would articulate greater things. They might start very openly and then say, oh, but not that. But the biggest problem truly was that they didn't understand the potential scope of information that their universities were capturing about them and how that data might be accessed, by whom it might be accessed, and how it might be used. And this comes primarily from the institution. Most institutions have no process to inform students, and they're not particularly interested in it, or that it's a one-time checkoff and the student doesn't realize what they've actually even clicked. And as we start to inform students, they will understand where the privacy issues are. We know that that is likely to happen with more information being made available to them. So we believe it's a good educational process. Shouldn't be a policy burden or something to try and get over or get past, but something to really engage the students with. Over the next couple of years, we're doing a broader survey on this same kind of topic. So we'll be surveying several thousand students and then focus groups for specific things. You can follow our progress on Twitter or on our website, and I'd be happy to answer any questions.
Thank you to all of our presenters. I certainly appreciate each of your contributions. So we will take a minute we have about 15 minutes to answer questions. So you can type questions into the chat box, or you can also type questions into the question box. I would also like to invite the panelists, if you have follow-up questions or reactions to any of the other presentations, please feel free to elaborate or respond in any way that you feel you could follow up with. So again, the questions can go into the chat box or using the question feature, and I can moderate those questions. So I see there's a hand raised, but I don't see a question. So if you'd like to type your question into the box, I can moderate your question to the panelists. Dr. Rosemary Fay would just like to say that all of the presentations were very interesting and she appreciated them. She is also section leadership for the ADEA Dental Informatics section, and I agree with her comment. Amana Nair said ditto. So we have a lot of support for the interest and utility of all of the presentations. All of the slides will be made available. We'll send them out through the Dental Informatics listserv as well as the Cori listserv. We will also share this recording via our YouTube channel. So all of that information will be disseminated most likely next week through those listservs. Please feel free to share with any interested colleagues who were unable to attend today. So if there are no additional reflections or responses, I'll go ahead and close out our webinar today. I want to thank everyone for attending the webinar, but more importantly, I'd like to thank all of our presenters and panelists today on sharing their projects and programs around data and learning analytics. This is the first webinar in our series sponsored by the ADEA Dental Informatics section, so please stay tuned for future webinars. We hope to have the next one in about 6 weeks. Thanks so much for your time and attention today.